Hello, it's George with Watchman German Shepherds. We're with Wanda and her litter at the vet. Wanda's not feeling good. She had a litter yesterday, and she was doing good yesterday, and she ate. And then today, she's not feeling good. She threw up some bile. I'm trying to get a picture of the puppies there. So she threw up some bile a few times, and she's not eating. And so Quakertown Vet is going to check her all out, and hopefully she's okay. Maybe she has a little infection or something, or they're thinking possibly a puppy is stuck in there, which if a puppy's stuck in there, then they have to take it out, right? So we'll see, and hopefully not. So let me get a spot here, and I'll continue the video when we get inside. Okay, so we're with Wanda and the puppies in the exam room at Quakertown Vet. And again, we're concerned about Wanda. She threw up a few times today. She delivered a litter 2 days ago. She ate yesterday, Monday, and then today she wouldn't eat, and she threw up some bile. And so we're going to check her out, get a culture there, vaginal swab, and see if she has any infection. And I'm going to take an x-ray too to make sure that she doesn't have a puppy stuck in there. I, again, do not think that is the case, but we're going to find out. And so Quakertown Vet is really specializes in some different things, right? They have the lab on premise, and that's really why I'm here. I have vets that are closer to me, but they have a lab on premise, and so they'll take the culture, and we'll know in just a little while, instead of a lot of other places that I go to, or some of the other places, they have to send it out, and then I wouldn't find out until the next day. So in this case, having the kind of concern I do, that she may have an infection, I want to know right away, and if we get her on antibiotics or whatever. But she seems, that's interesting, since we got here, got out of the car, she has really livened up a bunch, and prior to that she was pretty lethargic and even just listless, not really moving around too much, and her eyes look much better right now. Hello, Wanda. And she's much more alert and all. Yeah, the puppies are here. She hears the puppies whimpering. The puppies are doing great. She's really taking care of them, even though she's a little out of sorts. So we'll pick it up as the process goes on here. The attendant checked her out.
Dr. Ariel.
This is the first litter,
Okay.
right?
Had him on Sunday. She had 4 puppies.
Exactly. Well, she had 5. The one with stillborn there.
Okay. And that's what we were expecting. We were expecting 4 or 5. Like, did we have X-rays preemptively?
No, I didn't have X-rays here. No, I just imported her. She had a sonogram over in Serbia. That's where she's from.
Okay.
We didn't do it. We didn't do. She was never here.
Okay.
And I didn't do an X-ray for puppy count because those are. You can't do it to the last puppy at the time, right? So,
Right,
like, for
yeah.
instance, I did have a bitch in here, and they said 5 or 6. Well, she had 9. But that happens all the time, right?
Yeah.
So that's not really so reliable. So
Okay.
I personally think she delivered all the puppies. I gave her some oxy after she was in labor. She had a puppy, and then an hour and a half later she had another puppy. Then
Okay.
it was 3 hours and 45 minutes. And after it happened, I realized she wasn't having contractions, right? And what happened was, all of a sudden, the puppy, the placenta, and a ton of blood just gushed out. It's like there was nothing. Then after that, she was not having contractions again.
Okay.
So I had some oxy on hand,
Okay.
and I gave her a shot, and 2 puppies came out within 5 minutes.
Okay. So
I don't think this
3,
puppy
she got
did,
the
but
oxy.
you want to take an X-ray, or if you can feel it.
I'm gonna check her out first
Okay,
and go
cool.
from there. I guess I'm most concerned about post-breeding things. There's
Right.
always still the potential of puppies, so it is always still good to look. But
Right.
maybe a little bit of a better test is to actually look what the uterus is doing and make sure that things are involuting properly, and that one, there's no puppies in there, two, doesn't look like she has like a metritis or like a uterine infection post.
Okay, so how would you determine that?
Ultrasound is usually the better
Oh,
thing.
better than an X-ray.
Yeah.
Okay,
Yeah.
all right, great. And my thing is, I'm thinking, and I'll disagree, right? I think she might have an infection, so
That's-
whatever culture we're gonna do.
We may not get a culture, but I usually put them on antibiotics because you're not going to wean the puppies, right? Are they still nursing on her?
Oh, yeah, the puppy's here, they're 2 days
hi,
old.
puppies.
Yeah.
Okay. All
They're
right.
2 days
Jimmy.
old. She's totally nursing them too.
Okay.
She's doing a great job with that, so.
So we want to keep mom nursing them. So usually I put her on an antibiotic that's okay for both of them,
Okay,
but we still put them on something protective so they don't like get diarrhea and dehydrate and things like that. So we
put them on what?
So she'll go on an antibiotic,
Okay,
but she can still pass the antibiotic in the milk.
okay.
So then I put them on something called Microvet. It's like a probiotic.
I
So
have-
you give it to. Do you have Microvet?
I have a ton of that, yeah.
Okay,
Yeah,
so
I'd
you'll
like
give it to
take
her,
that.
and you'll give it to the puppies.
Okay.
The puppies is like just like a fingerful on their mouth.
Just a little bit.
Yeah, yeah. Okay.
Yeah,
But she'll need some
I
too.
literally have a bag of that.
Good. Okay.
From you guys, thank you.
Fine.
She's a good one. She's doing very good. When I first got her, she was a little nervous.
Yeah.
I deal with good breeders over there, but
See your tongue.
sometimes when they travel,
She's got a little ulceration on her tongue.
what?
Ulceration on both sides of her tongue.
Oh,
See?
really?
Yeah. Do you see that?
What? Oh no, I'm not sure what you're saying.
This. Do you see that? And that?
What is it from?
I don't know. Curious. It's in an interesting spot. It's like
Oh, you're saying it's an ulceration?
yes, it's ulceration. So like if she got a lingual ulcer, so like the skin is like see how this is nice and pink, and then it
Yeah.
gets a little yellow.
Yeah.
Yeah, that's like an ulcer on her tongue.
And what can cause that?
A lot of vomiting, but that would be an extensive amount. There are some disease process viruses that can cause that.
Okay.
She up to date on everything? Like her vaccine wise before she came over? Usually they
Yeah,
have to
well,
be.
I have the records actually here, and yeah,
Okay.
before they ship the dogs and whatever, they have to get them all checked and up to date on the shots right before they can send them internationally.
Yeah, they usually
So I do have the paperwork, like the rabies shot and whatever other vaccinations.
And was she bred here or was she bred
No,
over
she
there?
was bred there.
Okay.
Now, she did throw up a few times this morning, so I don't know if that,
That could be if she's got a good uterine infection, that could cause nurse discomfort. Her milk all looks good. I'm just working on those front ones.
yeah, so the ulceration with the vaccine, with the antibiotic potentially help that
I
there?
may have to put her on something a little different to give her a
Okay.
little bit more comfort, but I still think it's okay for pregnant with dogs. I'll double check. I always have to double check everything.
Okay, yeah, that's, you do that. I just said, she seems much better now, like much more energetic than this morning. And
Yeah.
even until I put her in the car, she was just like, she's feeding the puppy, she's cleaning the puppy.
Yeah.
And she just was doing nothing else.
She's taking everything out of her.
Yeah, and so I thought it could be this normal, just had a litter thing, which it's a little, she's just a little too lacking in any energy there for me. And so I thought
There's like
So-
nothing she can chew, right? Like
maybe- as far as in the kennel
like
and stuff.
wires or anything?
Well, she did actually, the welcome boxes would say that, right? And before, a lot of females, they'll scratch before they have puppies, right? Like dig, make that like a burrow type thing.
Yeah.
I'm
sorry, I-
holder.
Yeah.
And she did that, but she also was biting the wood from the, I have 2 by 3s on the edge so the puppies don't get stuck. Like the puppies have a little room, like the
Yeah.
mom lays down. But she was biting that wood. And there was a bunch of splinters.
Water discharge back here.
There was a bunch of splinters in the whelping box, so, whatever that may have done, I don't know, but yeah, she definitely was chewing some of that wood. Fresh pine wood, I just built the box. So if that did something that you're asking, I'm not sure.
Yeah.
So what are you saying back there?
She's got a lot of discharge coming from her vulvar area, so I wouldn't be surprised if she's got like a metritis or something like that.
Is it blood or pus?
It looks
Like
like
an infection type thing?
doesn't smell great. It could be blood. It could
Okay.
be like the normal thing, but like I would say we can go on the ultrasound, check her out.
Okay.
Okay.
Yeah.
So hang out in here. I'm gonna call down to her and see if she's available to do that.
Okay. Yeah, so that's in the other room over there?
It's actually gonna be
Yeah,
down in
inside
the
the
new
building?
area, but they're gonna borrow her.
Okay.
They usually
Because
borrow
I've been
her.
over there, that's why I'm asking.
Yeah, it is gonna be in the new area, but we'll borrow her. We're just trying to limit traffic at the moment.
Okay. Yeah,
Everything going on.
Yeah, sure.
So we'll come borrow her in a second when she's available and get that
Okay.
done. I'm gonna go chit chat with Dr. Orban, who's luckily here today.
Yeah, I know that.
Yeah.
She's your reproductive.
Yep. So I touch base with her anytime she's here.
Oh, yeah?
Yeah.
Okay, cool.
All right, hang tight, okay?
Yeah, so what do you think, like, just so I have an idea?
It might be about an hour. I gotta call down to her.
Good.
Yeah.
So, like, I'm thinking, like, I could probably not have her nurse the puppies
Yeah.
during that time, so
Yeah.
where?
I can get you a blanket.
Yeah, blanket, good. Great, thanks.
Okay.
Yeah,
All right.
yeah. Oh, what you doing? What you doing? Oh, you big nose out of there. Come on. Come on. Good boy.
Okay, it's George back with you here at the vet with Wanda. The vet came in and she checked her out. They're gonna put her on some antibiotic. We're gonna do an ultrasound, and they're gonna make sure there's no puppy in there. But they're also gonna check her uterus. No puppy in there. In other words, a puppy that is just stuck in there and never passed when she delivered the litter. So. A couple of things there. So they said about an hour until they can get her in for an ultrasound. It's real busy. This is the time with the crazy coronavirus and all. And so everybody is backed up, and the vet is no less backed up. And so they thought maybe an hour. Also, I came in on an emergency basis. So I don't have an appointment per se. But they're going to see her, and it's looking like the vet checked her out there, checked the girl part out there, and she said there was an odor, and it looked like, some discharge. Maybe not just blood from having delivered or litter, which is normal. The females can bleed a week or even longer after from the time when they actually deliver the litter. So she had a concern there, which is kind of what I'm thinking, that she has some type of infection. And so whether it's a viral or bacterial infection, we're going to see. But they're going to get it set up, and the puppies will be affected from the milk. In other words, the antibiotic they're planning to put her on, that's usually the course, she said. They're going to test and find out more particularly, but it's likely she's going to be on an antibiotic, and that will get to the puppies through the milk. So, as they do, they give a probiotic to the puppies and to the mom when they're on an antibiotic. So, the antibiotics kill indiscriminately the good and the bad, and then the probiotic will replace the good. And so we'll see how that all goes. So, all right, we're going to get her set up for a while to feed the puppies and nurse them a little bit, and then we'll be back with you. Alrighty, next phase, they put us in this little waiting room, actually a big waiting room. I've been in here before. Actually, I had a litter of puppies in here with Dahlia. It came on an emergency, and Dahlia ended up deciding to have puppies in this room. So we have Wanda and her puppies, and we got this little bed here, and Wanda's gonna nurse the puppies, I'm sure, any minute. She's just getting settled herself, and so I'm sure once they start crying, she'll start moving. Alrighty, we'll cut it off here for now. We'll pick it up, but we'll see what happens when we get in for the ultrasound. They're going to check her uterus, and they're going to check to make sure there's no puppy in there stuck in there from the delivery 2 days ago. Again, I do not think so, but I won't know for sure until we get her checked out. So the puppies are doing very good, and that's good. And Wanda looks a lot better, and that's good. So I'm hopeful. And of course, it certainly seems like she's going to have to get some antibiotics, and that should help her too. So, all right, we'll get back soon. Hello, we're back with Wanda. They brought her back in. I'd taken her over to the room by herself. They did the ultrasound. She smells like alcohol. They rubbed that on after, just to clean her all up, as they put the little gel on her, and then they used the alcohol to clean the gel off. And so you can't smell it, but I can. The vet asked if I had counted placentas. With each puppy, there should be a placenta. And I did not, per se, but I'm pretty sure, now that I think of it, that all the placentas were accounted for. So maybe she's thinking that there's a placenta in there. I'm not sure. She didn't say to me, but I'm not really sure what they can tell with an ultrasound. Well, besides that, so the thing is that she has her temperature's up a little more now. It was 103, now it's 104. So it would seem definitely some type of infection is going on, and we'll see what all happens. And Wanda got a little upset, I think, with the whole process. Nervous, really stressed out. But she's settling, I can tell. Wanna look at Dad? Wanna look at Dad? Wanna look at Dad? Good girl. Yeah, she wouldn't look up at me there. She's definitely stressed out. So, we'll keep touching base here and make these little clips. We'll see ultimately what's going on with Wanda. Again, she just had a litter 2 days ago. I kept saying yesterday, but today's Tuesday. I lost track of things. So she had the litter Sunday, and then today's Tuesday. I have her at the vet because she was throwing up some bile and she wasn't eating today. And she definitely was not herself. Yesterday she was pretty good. She was eating and all that. So apparently something is going on, and we're going to find out, I trust. The puppies, really, I've said this, they're doing good. She's very good with them, so for all her problems, she's being a good mom here. And so hopefully we'll have a ready remedy and get her back on her feet. What do you think, Wanda? There she goes, at least looking up. Good girl. Good girl. Yeah, you never know what goes on, what they think about there, but she obviously is a little stressed out. So we'll get back and we'll see what the next step brings, and I'll give you a report and update on that. See you in a few. Hi, it's George. We're back. The vet just left the room. We talked about everything. They think there's possibly a placenta in there, which is not the underlying problem. They think the placenta will either be absorbed or it will be discharged there over the next couple of days. She does have an infection, so they're going to give me some antibiotics, some amoxicillin, a high dose, and we're going to get her on that, and then some probiotics, just like they had said earlier before they did anything. And they're talking about making sure she has fluids. They want to give her a shot to hydrate her, a little fluid. She's not dehydrated, but they're just concerned that she's getting enough fluid because, of course, she needs that. So I turn that down. I feel once she gets the antibiotic in her, the amoxicillin, that her appetite will come back, not only for the water, but for food also. And so it just kind of came on. The infection probably came on during the delivery, which was Sunday. She was fine yesterday, and then now today she has all this going on. So it can happen, of course, obviously. And I think that once we treat her there with the amoxicillin, she'll be real good. So we're going to see in a day or two. The doctor said if she doesn't rebound in a day or two, start drinking normally and eating normally, then I have to bring her back, and we'll at that point do a blood work and try to find out maybe if something else is going on. And another thing, she had noticed a laceration on Wanda's gum, or her gums, and so she's not sure what that is from. She said for a dog this age, Wanda's just over 2, she really shouldn't be having that type of issues. So it could be related to the infection, possibly. She didn't necessarily think so, but she can't rule it out. Or it could just be a separate condition, a dental condition there that's causing her to get some lacerations on her gums. Again, it would be kind of early, a 2-year-old dog, but we're going to put a little ointment or something the vet is going to give me that I did think was a good idea, and maybe help that condition there. And just keep an eye on her gum. So it seems that's probably a separate condition. And so Wanda, well, she growled at the vet. She didn't bite her, but she definitely let her know not to get any closer with the puppies. She did the same thing with my wife. And so if she doesn't know you, well, you're not going to get too close to her puppies. And I think the same thing happened, as a matter of fact. She didn't have the puppies with her when they did the ultrasound, but I think she let them know to keep the distance too. So she's in a heightened state here. She's not feeling good, and just a few things coming together to keep her a little on guard and a little letting people know I'm cranky today. And so I think that'll do it. I'll do another video if I have to bring Wanda back, but if not, no, I'll do just a final thing there, hopefully tomorrow or Thursday, 24 to 48 hours. The vet said the amoxicillin should really do its job there, so I'll do a little update, a separate video update on that, just to keep you informed. And so we're going to cut it off here. This is George with Watchman German Shepherds. Do appreciate you subscribing and liking and sharing. Please, any questions or comments, if you have any questions about this vet visit with Wanda, the West German Showline German Shepherd that just had a litter of puppies and now is at the vet with an infection, probably from the delivery. Just let me know if I can answer any questions. First time that's happening with me, and I hesitate to say that because I'm thinking a few months ago we did have another female, Riva, and it turned out that she had an infection too. So this would be the second time. And so apparently it can happen, right? A lot goes on when they deliver a litter of puppies. Well, any questions or comments about that, I appreciate it. And until next time, the Lord bless you as you trust Him. Take care. Hello, we're back the morning after Wanda had her vet visit. And so she had her antibiotic last night, and then she just had one again now this morning. Plus they gave her the probiotic. And the puppies, they're also getting probiotic because they get the antibiotic through the milk. So she's doing very well. She's eaten twice now, which she was not eating. She didn't throw up, which she had thrown up a few times. And so she looks a lot better. Her coat actually looks brighter. And she's much more alert and doing her job. She had been doing her job, but now she seems much more a part of things, I guess I would say. So this will conclude this little video series with Wanda and her post-pregnancy illness. Just one note is that I said that the placenta that didn't come out, right? The placenta that's in there, or hopefully will get absorbed or come out. I said in one of the videos that wasn't part of the underlying cause for the infection, when in fact it is. The vet suspects that is the cause of the infection. So my misstatement there, and so that retained placenta, as they refer to it, is likely the cause of the infection. And so, well, thank the Lord for the antibiotics, and she seems to be recovering even just after the 2 treatments, and I'm very thankful, very happy. So, George with Watchman German Shepherds, thank you for subscribing and liking and sharing, comments and questions. I do appreciate them. Above all, as always, the Lord bless you as you trust Him. And until next time, you take care.